Hello there, good evening everyone. My name is now officially Dr. Muhammad Shah. Welcome to another episode of That. Today we are joined here with us with a very special dentist all the way from Italy, and she's very special in many ways. Please give up your hands for Dr. Tessa Waldhart, all the way from Italy. I cannot obviously press the clap button, but she is one of the most amazing female dentists I've come across. So a little bit about Dr. Tessa. She works at a family-run dental clinic in Italy with Waldehart and Dr. Lodi. This clinic was established about 40 years ago, and after the retirement of the previous generation, Dr. Christian Waldehart, which I believe are your parents, right?
That's right. Actually, by my great grandfather.
Your grandfather, yes. So the way how Dr. Tessa is different, and what I see is that after you, Dr. Tessa, graduated from the University of Vienna, you joined this global oral health work instead, where you started working for an NGO as a creative communications officer, which I've never seen anyone else do this sort of thing, where they're working as a designer as well as a dentist. So that's something really interesting. And apart from that, you also have a research paper published as well, if I'm not wrong, which I believe is the effect of methods of administration to the oral health related quality of life assessment using early childhood oral health impact scale. Is that correct? Because I just
That's
found
right.
out while the team was doing this. Anyways, so Dr. Tessa, how are you?
I'm fine, thank you. Very fine. After a long working day. Well, not so long, but intense working day.
So, Dr. Tessa, if before we ask the audience, the audience ask questions from you, what would you say how dentistry has evolved in a nutshell, especially being a female dentist? How do you think it has changed its root? Before COVID, how it was differently and how it is differently now, especially for a female dentist.
You want to hear about changes like pre and after COVID?
Yes, especially being a
Well,
female dentist.
I think that for sure, like on a personal level, I take way more measures about proper hygiene and sterilization processes, and I think in general, dentists became just really more aware how important it is to to always be on top of hygiene protocols and all this because yeah, I feel that's where the whole problem started actually with COVID. And I mean, it's not that we are still like crazy dressing up
Mm,
as astronauts, but just making sure that the safety standards are always
mm.
yeah, top of the art.
Okay, Dr. Jassa, if I would ask you, how has how is a female dominance in dentistry shaped the dental industry in Europe specifically? I mean, it still is growing in Pakistan in a lot of places, a lot of parts of Asia. But how do you think it has changed in Europe? Like especially women dentists in leadership roles like yourself, which is amazing. So how would you say, how has it changed drastically from a couple of years ago where we had more male dentists in leadership roles compared to female dentists now in leadership roles? So how do you think that has changed over the years?
I mean, I have to say that I always came maybe like where I studied at University of Vienna, or also
Mm,
having like my mother, having grown up with my mother who was for 40 years an orthodontist actually.
wow.
I think yeah, I think I never really saw it so male driven the industry, but probably it was. But from my perspective, I can just say that it never really felt so male driven. Also, at the University of Vienna, where I studied, I mean, I wrote my thesis in pediatric dentistry, right? And actually, that was quite interesting because right when I wrote my thesis there got nominated to take over the pediatric dentistry department. Actually, the first, I think she was at the time the youngest professor, female professor in Europe who got the chair of pediatric dentistry. So I would say I was always very, very influenced by female dentists. Um,
That is amazing. That is honestly amazing. To understand to having the first ever female dental care person in pediatric dentistry. That is amazing. That is really good. Um, Going on further, since we have a very short time, in your experience, what are the main obstacles that female dentists face in Italy or globally when it comes to leadership roles and recognition?
Mm, I think maybe from perspective of patients, still there can be some mistrust about female dentists because some patients maybe are used to a rough man hand and so when it comes like to difficult extractions or thing, it can be quite let's say impressive to make it positive to see like women perform heavy surgeries. For example, my partner, she's like really a great oral surgeon. So
Oh
maybe in the
wow.
beginning, and also young, like young, I would say very young. We're both quite young, and for some of the older generation, it might be yeah in the beginning a little bit how do you say strange to have this young woman
So,
um,
sort of
yeah
like a
in such
different.
responsible positions, right? Because I think dentistry has to do with a lot of responsibility. I
Hmm.
always say it's not made for everybody because I really do believe that within this job you have like a lot of responsibility on people actually.
It's like I was reading this quote the other day, and it said that a dentist is like a therapist, is like a person is a person who works using art, and finally is a doctor. So a dentist is anyone, especially that has three qualities: a therapist, doctor, and is an artist. So that is what makes dentistry so different from other medical fields as well. Because your job is not only to treat the patient, but it's also to comfort them and to make them less anxious about it. Because although I've not, I mean, it's just the start of my journey as a dentist, but what I've observed so far is that in a lot of the times, especially when I'm interning at, there are a lot of patients that I've come upon they where they do not get their tooth, if they have any sort of carious lesion, they will not get it treated until and unless that pain goes really deep down and really affects other parts of their face. I've also seen in other cases where one of my professors told us that she had a patient where where her husband would never sort of talk to her, and used to always just be busy with work, and she sort of craved attention. And I mean, it's normal to know whether in a relationship or marriage, you obviously want that your husband or your wife talks to you, right? It feels very off weird and indifferent. So the only reason she came to the dentist was so that her husband can sit down and talk to her, and like see that she's in pain, like she faked the pain. So so
Oh,
it's like an amalgamation of different qualities, and I feel like that's what makes a dentist special. Even being a female dentist, you know, I feel like female dentist is like is like a mix of different things. They make you feel less anxious. At the same time, they're really happy and jolly, and the artistic point of view also comes in. Like I'll give you an example of yourself. Like I feel like we connected last year around the same month, if I'm not wrong. And when I came across your page and when I talked to you, I was like, this, like, overall as a person, Dr. Tessa is a really a jolly bunch of an amazing person. All really happy and always really busy with her work, creating art. I even see your Instagram reels, and for me, it looks less of a clinic, more as like a bakery or something where people are laughing, enjoying, they're like creating something, and that is what it really makes me, happy in. And I'm being very honest. I always, whenever you upload a reel on the clinic page, I always check it. I always like it and see, okay, what's going on next. Where the improvement
Thank you.
is.
That's so kind of you.
Of
That's
course,
really sweet.
exactly. Um,
No, I think you're completely right. And I always say, I think you can be the best clinician ever. You can be the most gifted clinician. But if you're the worst psychology, I feel then if you're the worst psychologist, then maybe there is lacking something for you, in my point of view, to be a great dentist. Because I think, to be a great dentist, you just have to be, as in every medical field, you just have to be empathetic. I think empathy is one of the biggest and most important core values that you have to have in dentistry. And of course, you have to be a good listener in order also to understand your patient's need. It's not always good dentistry, in my point of view, cannot always be done by the book, how you have been learned it in dental school, because you have to take in consideration so many different facts for the patient, like what's the financial situation, what is the personal situation of the patient. You just have to, yeah, you really have to design, I think, a treatment plan based on so many factors and not what's always learned, of course, in books. And yeah, you just have to be a good listener to be a good practitioner, in my point of view.
that is true. Moving on, do you believe that traditional dental clinics, often family run like yourself, provide better or worse opportunities for women dentists compared to academic or hospital settings, and why? Like, do you believe that working in a traditional dental clinic as female dentist, especially family run, majority, do you think they provide a better experience, better opportunity, or worse
Listen,
opportunity for a lot of women who are done working in academia or in research or in hospital settings?
I mean, I've just been recently past summer at the IADR, International Association for Dental Research
Oh
Congress in
wow!
Barcelona.
Congratulations! Congratulations!
And there I really saw that like a lot of researchers were actually female researchers, which was very, very great to see, like working in academic institutions. Um, and I think like both things, obviously, as everything in life has its pro and cons, right? But I tell you from a women perspective, like it's amazing to have your own dental clinic, but also on the other side, as we women, maybe some of us want to be mothers. It can be very, very challenging when you are an independent business owner, because then you have to
Mm,
see it from a business perspective. And like, for example, maternity leave and all these things are obviously easier when you're employed at an academic institution. So that's
exactly.
definitely something where I wish that the states would help out more female entrepreneurs in terms of maternity leave and yeah, these life-changing situations. So maybe
So
there it's easier to work in academics or in hospitals, and also in terms of retirement. Like retirement is another other thing to take into consideration, which is
mm,
probably easier and better paid, safer if you work in an academic institution or hospital.
okay, so basically, in short, I agree with most things that you said because even in Pakistan, especially, even when I was in university in dental school, a lot of the professors we had, majority of them were female professors, and most of them either were like completely in academia or some of them were basically their parents, other cousins, or they had some other dentists in their family and they were working in those clinics. So majority of the female professors were doing research and only academia or working in the institution itself. So I completely understand because there are a lot of factors in consideration, and I feel like also depends on a region as well. Like obviously, the laws in Europe are completely different. The laws in Asia are completely different. So I feel like it depends on region wise as well. But in short, you know, for in short, academia is basically, in some way, you could say, better for female dentists because they can practice, and if they want any research data as well, they can collect that. Like they're doing both. I mean, they're doing clinical work as well as academia work as well, along with research in an institution where you do not have to worry about the business point of view. But I feel like it sets each and every human being apart. So if any female dentist has her own dental practice, maybe alone or maybe with another female friend or anything, it's sort of like setting her apart. What's setting her apart from each other? That's why. So that is what I feel like is also what makes each individual different.
No, for sure. And also, I mean, for example, like with the sales people who come around and try to sell you stuff, like it's very often men dominated here, at least in Italy. And so yeah, you have to be quite strong as a woman to manage everything. But well, it's doable. It's
Hmm.
hard, but it's doable, and it can be beautiful.
Exactly. I mean, I told you about my mother, right? I really look up to my mother because she's an orthodontist as well, and I've assisted with her in a lot of cases. Actually, uh, although I didn't get a top grade in ortho, but what I can say for sure, at the end of the day, I learned so much about ortho from a young age, and a lot of like the theoretical stuff that I saw in the books, I saw it firsthand because of my mother, and I really look up to
So you always must have seen her like as this, well, as this really source of inspiration
her.
and strong, powerful woman, no?
Yep, she is. I mean,
That's
if you
beautiful.
if you come to Pakistan someday, I'll definitely come to our clinic, and definitely you'll meet her, inshallah. She's an
I
amazing
would love
person.
to. And she
Yeah,
must be so proud of you.
yeah. Moving on. Okay. What advice would you give to younger women, especially from underrepresented communities or countries? A lot of the global population, considering people from different ethnic backgrounds, that they could be red Indians, they could be indigenous people, but we are talking about females especially. What would you, what advice would you give them to pursue dentistry, or or pursue dentistry for, especially for those females from different ethnic backgrounds, or from minorities, or females who come from communities that are not really highly developed. So how would you sort of motivate them or give them advice so that they do not feel discouraged by the gender gap in social norms? Because in a country like Pakistan, there you have a lot of minorities and different cultures, different languages. You'll find you'll find people, both men and women, from different ethnic backgrounds. So I feel like, what advice, if you were to give any advice, what would you give these women? Any advice?
Learn how to say no. It's like really a big thing. Don't let people tell you you are too sensitive or you are whatever, too beautiful to be a dentist or too, yeah, especially too sensitive. Like to,
Mm.
I think I tell you that when I was a dentist, I remember still up to this day that one of my doctors told me literally one time, like, oh, you will never be a good dentist because you're just too sensitive. Your skin is too thin. And
Okay,
it
that is
and
good. That
yeah,
that
like you're too emotional, your skin is too thin, you're too empathetic. And really I hear the word still. They came from a man, and I found it was very upsetting. And I would tell them not to listen, not to listen. be strong and say no when you feel there is like you have reached your boundaries, make your boundaries clear, and never give up and go for it. And I have to tell that I'm working weekly with students from different parts of the world. Some parts might be less developed, some more developed. And yeah, it's just always really heartwarming to see those women going for their dreams, making it, especially like making a change in the community where they are from. Um, and they can do it, and they are doing it. So I have no doubt about
That
that,
is that
that
is that is that
women can
that
take
is.
over the dental world.
I mean, they are. They actually are. If you look at a lot of female dentists, there's this female dentist, and from Pakistan, and she, I believe, if I'm not wrong, I don't know the whole story, but she basically was the first person to sort of do a research in green dentistry, you know, from this region. I don't know her name. Apologies for that, but she did something in green dentistry, and that
Oh,
was
wow.
that was huge. That was huge. Okay, moving on. How can mentorship? So this is generally for everyone, but considering our topics for women empowerment in dentistry, so we're gonna be focusing on this. In your, how can mentorship, global collaboration, combining dentistry with communication and public health advocacy help change the face of dentistry for women? Because if you look at it right now, compared to before COVID, and obviously before COVID, and generally overall in the global population, you'll see that more women have started doing global collaboration. Like you yourself, have worked in many NGOs with, you know, the Oral Health Alliance Across Borders, where I believe you are the
Run by
main
a
point.
woman. I just
Yes,
want to point out, run by my amazing friend and professor like Dr. Deborah Weisfuss. So totally run by a woman, this organization, and actually in the chair there are many great other professors, women professors, Dr. Mascarenas, Dr. Wandera, professor, sorry, all professors. But really, that's like so many great women coming there together, which I'm forever grateful. And sorry if I miss any names at the moment. But yeah, mm, so yeah, sorry, keep going.
okay, no, that's amazing. So I only knew about two people. I think so. I'm not going to the full page, but when I came across, the organization itself, I found it very interesting, on how they're doing things differently compared to other NGOs across the globe. Moving on, in your opinion, so this is a question which is related to education, more of what universities can do, what solutions and what associations. So, in your opinion, what structural changes are needed in general education associations and workplace policies to support more gender equality among dentists, female dentists, and generally the male and female both? Because if I'm not wrong, in Italy, the number of female dentists are less compared to male. If I'm not wrong, or maybe correct me if I'm not wrong.
I would have to look that up. I'm
That's
not sure,
fine.
but I trust you. I trust you are right.
So So, like, what do you think? As being a part and leading an NGO with your friend yourself, how do you think? What policies should other workplace or other that are corporate dentistry or any other NGOs should focus on for female dentists, so that they get the same equality and same fairness that a male dentist gets.
I think again it has to do with support, like about family planning. It always comes, I feel that it comes down a lot to it, like the situation always that change in the moment where there is family planning involved in terms of motherhood and setting forth your career goals. So I
Hmm.
think that's where. Um, I don't know if it's ever possible to get equality there, but that's where more room, more space for equality has
It
been
needs to be
given.
worked on. It needs to be worked on, if I'm not wrong.
Mm.
Okay, so last two questions, and I feel like these are my favorite questions overall, because I feel like they define you as a person. And I think this meeting is running out, but we'll start another meeting again. Okay, there we have time left. Okay, so these are my two favorite questions, which I feel like define you as a person. Has there been a turning point in your career when you realized the importance of women empowerment in the dental profession? Could you share that moment slash story? Because I've seen your work, and I'm pretty sure every time we talk, there's always something new that a new story that you tell me about something that you've done that really changes the map for women in dentistry.
Like where there was a turning point where I felt it was unfair, you mean?
Yeah, exactly. And it could be in any way. It doesn't necessarily need to be academia wise or clinical work wise. It could be anything.
So I tell you, it was when I was a student. I was sharing
Okay.
my box, my dental box, with an amazing woman, so smart. Like she was already a finished doctor, did night
Oh,
shifts, did night shifts in the general hospital, like was coming back from, I don't know, crazy surgeries where she basically was in a team of reconstructing a face after a suicidal attempt or something like this, like really really serious maxillofacial surgeries. She was working all night, came back to the clinic to do some fillings, like for her maybe baby stuff, and she got criticized so heavy so often by some male dominated hierarchy leaders. So having witnessed this, I just, it really was unfair in my point of view, um, and just totally outdated.
so
And
so if you don't mind me asking, that like how long was this? Like how long was this?
how long was this ago in my life?
Hmm. Yes.
10 years ago. No,
Oh,
10 years ago. And she did, I mean, these women did, like, again, was already a general doctor and then had to do dental school to become a facial oral surgeon.
oh, okay, okay. So she was a doctor in medicine, and then she moved on, a general surgeon basically, and then she moved on to do facial oral surgeon. Okay, I've heard of it. Basically, a facial reconstructive facial surgeon, right?
Exactly. And just a very also very beautiful, sensitive soul. And again, like with being so sensitive, yeah, she had to pay very often the price. And I think that was just not not fair. Well,
So if I would ask you, one of the reasons that you started Oral Health Alliance Across Borders with your beautiful friend, I keep forgetting her name. What's her name again? Doctor?
Dr. Weisfuss?
Yes, Doctor Waitress. Who she started Oral Health Alliance with you, right?
No, no, no. She's the founder. I just became part of it. I became part of it due to my work of Humble Smile Foundation,
Okay,
where
okay,
my amazing, like amazing Dr. Darren Weiss, who really
Darren.
opened me the world to community dentistry.
Okay,
Thank you, Darren, who made
Darren,
me
if you're
go down
watching this,
another path.
Darren, if you're watching this,
And
Doctor Tessa is saying thank you to you.
yes, he's really a brilliant mind, brilliant mind. Anyway, who changed my roadmap, really, who changed life changing. Anyways,
Oh,
but yeah, I got just called upon the team of the alliance, and it's touch, like we have weekly meetings. We do a leadership course for dental students all around the world with community dentistry weekly. It's touching and it's really hard feeling. It's
Do you
totally
think
voluntary.
do you think, something like this, like there could be a collaboration between Oral Health Alliance across borders and that Dastan, which I started? Do you think there could be a possible collaboration or something? We could, because when I
Sure.
first talked to them, I was like, I was like, I really want to, we should do something like this, where we could work across continents, for a goal, for something that's really going to, slowly pave the way how dentistry is going, like 5 years down from now, 10 years
You
down
know
from now.
what I suggest? I suggest that we invite you. I will speak with Dr. Wisfus, and we will invite you to maybe a study club or something, to a think tank.
Yes,
How about that?
of course, I have done think tanks a lot in college, but yes, of course, why not? It's really new way because it's really because I really want. So we're going to be conducting this first workshop at Dastan, where how research is using a lot of AI tools to really help us minimize the process of turning data and doing the meta-analysis and all of the other stuff, which basically extends the research timeline before you publish it. So we're trying to do that workshop. I took one of these workshops at Aga Khan University here in Karachi. So yeah, we will be doing an online workshop soon. So I would love to have you also, attend that. That would be something really different if you have not attended something like that.
Well, we will explore all the further
Underrepresentation in leadership. What role can women like you play to inspire the next generation? Like, what do you think women like you, or any other women, can, bring inspiration to, a lot of younger girls, who have not even entered dental school or are currently in dental school? How can you inspire them for the next upcoming generation, the next generation of dentists?
No, I think we should not inspire the next generation of dentists. I think all these women, entrepreneurial dental women, should inspire finally governments to really change policies on oral health care, because it cannot be that oral health care is still not integrated
Beautiful.
into
That is an amazing
into
statement.
into universal health coverage. Like it's still this big gap that not everybody can afford dentistry, and it's wrong. And I think this is what we need to inspire people.
Yes, exactly. Anyways, I hope all of you enjoyed this new tooth tingling episode of Danta, featuring me, your host, Dr. Muhammad Shah and Dr. Tessa Waldhart. Thank you guys. I hope you
Thank
enjoyed.
you so much. Thank you for
And
having me.
thank you. Bye bye.
Ciao. We speak soon. Thank you. Ciao.